everyone, my name is Kimberly Wasson. I'm in the final phase of my BSN program and doing a capstone project, and this presentation today is part of that project. I'm doing it on pressure ulcer prevention through evidence-based practice. Again, thank you all for coming, and a special thanks to Patrick Nobles, my advisor, for putting up with me through all this. So first of all, we're going to talk about some objectives. See down, some objectives for pressure ulcer prevention. So today I want you to get from this at least 3 facts related to pressure ulcer prevention. Let's just call it PUP, because that's a tongue twister. We're going to identify 3 risk factors related to pressure ulcers, or PUP. We're going to review some recommended evidence-based clinical practice guidelines. We're going to review the components of the skin bundle approach and demonstrate proper technique in filling out that skin bundle assessment. Everybody's got a tool, so be looking over that when we get to that in the presentation. We're going to combine all the concepts for best practice for pressure ulcer prevention. And we're going to have a discussion at the end to express our comfort in identifying and implementing PUP in our current place of practice. So, just the facts. You have a handout there with all the facts on here as well. If you want to follow along with me. Approximately 2.5 million patients are diagnosed and treated for pressure ulcers in the United States each year. Between 1993 and 2006, the total number of hospitalized patients that were diagnosed with pressure ulcers were a startling 80%. That cost was $11 billion a year for treatment of those patients. And out of those, 60,000 patients died from complications related to pressure ulcers. CMS, they place regulations on reimbursement for hospital-acquired pressure ulcers, so it's a huge financial burden for healthcare facilities, which in turn increases the accountability for nurses. Some risk factors. Again, you have a handout on risk factors. This is very important because we're going to take a little post-test at the end and reflect back on some of these, so you might want to look over those. Obviously, advanced age, inadequate patient mobility, severity of their illness, the higher acuity patients, chronic medical conditions, if they're incontinent of bowel or bladder, pain, malnutrition, and obviously the higher acuity units like the critical care units or any unit type patient. So, some evidence-based practice guidelines or major recommendations for pressure ulcer prevention are up here. First and foremost, the support surface. You want to evaluate the need to change and to a redistributing support surface. Utilize different features such as turn assistance, percussion as needed. You want to evaluate the need for change in that surfaces based on the individual, if they can't turn themselves for any reason. Repositioning. First and foremost, initiate a repositioning schedule as soon as possible after admission. You want to use foam cushion under full-length calves and elevate the heels. You can use them in the chairs. Positioning, you want to position the individual off the pressure ulcer as much as possible, or any bony prominences so they don't get pressure ulcers. You want to assess the skin frequently for shear injury. And nutrition management, there's not sufficient evidence to support that any additional nutrition interventions in these types of patients prove to be recommended, but certainly the dietitian will assist in that area. So again, you have in front of you the Skin Bundle Bedside Tool for Pressure Ulcers, and what that consists of. SKIN is an acronym for Skin skin status, surface, keep them moving. Incontinence, which will improve moisture management. And back to nutrition and hydration. So some of the guidelines for this tool are, again, surface. You want to select the correct mattress according to your hospital's protocol. Use pressure reducing cushion in the chair. You can check, make sure you check your equipment for patency. Don't use multiple layers under the patient. You want to keep your sheets wrinkle free. Be sure that the patient's not lying or sitting under tubes, lines, drains, cords, anything like that. And reassess pressure risk. In our facility here, we use a Braden scale and reassess that the equipment that you're using is the proper equipment. Keep moving. You want to reposition that patient. You'll see that I left it blank, but at a minimum every 4 hours while in bed, 2 hours while up in the chair. Certainly it's patient specific and based on assessment. You want to use numbers to identify the patient's position, inspect the skin, and document every position change, or once every 24 hours if that patient is able to move unassisted. So also encourage mobility in patients that are able to move. To continue, incontinence for patients with incontinence, you want well-fitting continent products. You want to wash the skin after each episode and daily with gentle soap and water, and refer to your hospital's protocol for diarrhea management. You may need a rectal tube. Then you have to worry about the position of that tube as well. And back to nutrition, you're going to refer to the nutritional risk assessment in the nursing notes or the patient's medical record. Most importantly, keep calm and bundle up. All of these together have shown to reduce pressure ulcers based off evidence-based practices. Again, in front of you, you have this tool. It's the Skin Bundle Bedside Tool for Pressure Ulcer Prevention. You all have your tool. If you want to take it out, follow me a little bit. We'll go over it now, and then after my presentation, we can do some demonstration techniques on how to fill this out properly, because that's most important. But if you look, it's up here, you got the date at the top, the time, your daily Braden score. Then you move into surfaces, what type of mattress you're using, inflation devices, alarms checks, chair cushions, any other devices, stuff like Granulex, those kind of things. It gives you a place to document all those. Keep moving is numerical. You just put 1 through 8, depending on if you've turned them right side, left side, if they're flat on their back, if they've stood up, if they've refused altogether, or were unable to move due to a medical condition. You can document that as well. Under skin condition, that is, you use alphabetical. You got A for normal, B for red and blanching. Again, you'll see the different, F covered by dressing, and then G, it would be the grade. If they had a pressure ulcer, it would be the grade of that pressure ulcer. So, under incontinence, this one's easy. Were they incontinent, yes or no? Do they have a catheter? Were their bowels moving? It's pretty cut and dry. And again, under nutrition, you want to see the nutritional risk assessment document in the nursing notes. If you do see something recommended by the dietitian, you can make a note of that. So your peers, your coworkers, those who are following you can easily look down and see if there's any supplements that were recommended. Does everybody understand that? You guys got it? Okay. Good deal. So, here's some best practice for pressure ulcer prevention. This is kind of where we combined everything together. You want to evaluate and document the risk assessment. You want to implement those appropriate interventions that we discussed for pressure ulcer prevention. That is your support surfaces. Make sure you got the accurate equipment in place. You may need to change it out based on your patient's condition. You want to position, reposition, improve moisture management, keep them dry, incontinent care, back to nutrition and hydration management, and then you want to document any deviation from best practice. Make sure that everybody is aware why you deviated from that practice. So I'll go over this slide real quick, but this is going to be a group discussion after we're done filming here. I know some of you don't want to be on film, and this may take a little bit longer to get some feedback from you guys, but I want you to be able to identify and express your feelings with implementing pressure ulcer prevention and your comfort level with it, and your comfort level with using your skills that we're going to learn here today and filling out the assessment tool. That's very important. Sometimes we go through the motions, but you really don't know how to fill it out, and that's really important, you know, for this to work. So, and then we'll have some just group discussion, open questions and answers. Okay, so in conclusion, pressure ulcers are reasonably preventable. The occurrence of them is one of the key quality indicators. It is considered a never event. It increases your patient's length of stay, and most importantly, it diminishes their quality of life. It reflects negatively and creates a financial hardship on the healthcare organization as a whole, to include you. So prevention is at the top of the list for the Joint Commission's National Patient Safety Goals. And nurses, we got to do our best and make every attempt available to decrease or eliminate these unwanted outcomes. And with the use of evidence-based practice like we've discussed here today and guideline recommendations, we as nurses, we have the tools to achieve the best possible outcomes for all of those involved, to include ourselves. So that is it for my formal presentation. I've got some evaluation sheets. I've got the post-test out there for you. We'll go ahead and go through some discussion, see what your comfort level is. We can go through the assessment tool, make sure everybody's comfortable with that. And before you leave, if you'll turn in your post-test and your evaluations to me, I greatly appreciate it, so I can move on to my next assignment. Thank you so much for coming. I appreciate it.